It's Yugochi Onwachukwueyu. I've got an appointment with the nurse this morning.
Yes, I can see you. Okay, please take a seat. Joe will be with you as soon as he's ready.
I'm Yugochi, and quite recently, I found out I've got cancer. I mean, what a shock. It still doesn't feel real, if I'm honest. I'm going to have chemotherapy as part of my treatment. What a terrifying word. I've got a million questions. I mean, my mind is in overdrive and my heart is racing in my chest.
I'm Joe, one of the nurses who'll be looking after Yugochi during her chemotherapy treatment. I know she's anxious. Who wouldn't be? Chemotherapy is such a big unknown, but I'm going to do my very best to answer all Yugochi's questions and, of course, help put her mind at ease. Yugochi, I know you have lots of questions to ask me, but is it okay if we perhaps first take a step back and talk through some of the basics?
Yes. Okay, back to basics. I suppose the basics are the best place to start.
So let me start by saying that chemotherapy is just a word that means medications, or drugs as we tend to say. Our bodies are made up of cells, like tiny building blocks, that replace themselves as they wear out. Cancer happens when a single cell starts to malfunction and keeps copying itself in an uncontrolled way. It might help to think about chemotherapy drugs as, say, a range of medications to destroy the cancer cells. In this way, they can stop the cancer from spreading or reduce the chances of cancer coming back. Now, although the drugs are most damaging to the cancer cells, they do still have effects on other normal cells. And this is why you may experience some side effects from treatment. The chemotherapy may be given as a single drug, but it's very often given as a combination of drugs and can either be given by itself or it may be given before or after an operation. You might also have it alongside another treatment such as radiotherapy, immunotherapy or a targeted treatment, which is a type of drug that acts specifically on the subtype of cancer that you've got. Is that okay so far, Yugochi? All making sense?
Yes, I'm following you. But you've got me a bit worried about how all these drugs are going to be given to me now. Like, I'm going to get piled on by the doctors or something.
Oh no, it's not like that at all. I just wanted to let you know what all the possibilities are. Let me tell you about the place where you'll have your chemotherapy first. Most chemotherapy is given to you as an outpatient in a day unit, so you don't stay overnight in hospital. We have chemotherapy units at Finchley Memorial Hospital, at Chase Farm Hospital and at the Royal Free Hospital. We take a lot of care to ensure that the unit is calm and organised and that you're comfortable and well looked after.
Oh, okay. So I'll be there a long time?
It's different for everyone. Anything from 30 minutes to several hours. You see, every chemotherapy is prepared especially for you by a chemotherapy technician, according to a specific prescription, and this can take some time. Your treatment is delivered to the unit on the day of your treatment.
What are all those tubes?
Oh, okay. Let's discuss those next. Your chemotherapy will be given by specialist nurses who've been trained to handle the drugs and give them to you safely. Now, the most common way to give chemotherapy is through a drip in your arm, so the drugs can enter your bloodstream directly. We call this an infusion. The drugs are then carried around the body via the blood. Now, some chemotherapy can also be given as tablets or capsules that you swallow, or as an injection. Having chemotherapy through a drip shouldn't hurt. Sometimes your arm can feel a little cold, but you shouldn't experience any discomfort at all. If you do, you should tell the specialist nurse.
Right, so I'll have to have all sorts of things then.
Well, like I said before, different cancers are treated with different combinations of drugs, and it's different for everyone. You'll be told exactly what you're going to be given before chemotherapy begins. Now, depending on the type of infusion, you might have a PICC line in your arm or a portacath placed in your chest at the hospital prior to starting treatment. These lines also sit in your vein and can be left in place for months. A nurse will access this line for your treatment. Okay so far, Yugochi?
Yes, okay. So there might be extra appointments. Not just coming in for my chemotherapy.
Yes. Let me tell you about the steps all patients follow through treatment, or the pathway, as we call it. Before each treatment, you'll have a blood test and also an appointment with one of the clinical team. This might be in the clinic or by telephone or even video. The clinician will ask about any side effects you've had, and they'll also check that your blood test shows that you're fit to have the next treatment. They may make some changes to your chemotherapy to help lessen any side effects that have been bothering you. A couple of days after that appointment, you'll then go to the chemotherapy unit for your next treatment.
Oh no, so I don't have everything on one day.
Oh no, it isn't possible to do everything in one day. But people soon get into the routine of having their appointment and a blood test, and then a couple of days later going to the chemotherapy unit for the next treatment. It's the same pattern each time. When you come for your very first chemotherapy, we'll give you a treatment record book and we'll write all your appointment dates in it, so it's a bit like a diary. The book also has your treatment details in it, and there's also space for you to write down any side effects or any questions you may want to ask the doctor or nurse.
That's a good idea. Everything in one place. So you mentioned side effects. That's the biggest problem, isn't it?
Okay, well, look, there's certainly the most to talk about here, so let's discuss those now. Like I said before, chemotherapy drugs are more damaging to cancer cells, but they still have effects on the rest of your body, and this may cause some of the side effects we're going to discuss now. But the key thing to remember, Yugochi, is that everybody's experience really is different, and you may experience very few side effects. Some patients actually have no side effects at all.
You can't do anything to stop them.
We're able to prevent or reduce many side effects as long as you tell us that you have them. So please do be totally open and honest about how you're feeling when we ask you.
Okay, so that's why that treatment record book is useful.
Yeah, correct. The biggest concern for us as the team looking after you is the risk of infection. Chemotherapy also has effects on your blood, especially a component of your blood called white blood cells. Now, they're the bits in your blood that fight infection. Chemotherapy makes white blood cell numbers go down, so your natural resistance to infection is reduced. And this is really important. If you get a high temperature above 37.5 degrees, or fevers, shivers, shakes, or just generally feel unwell, you must call the helpline. And if it's over 38 degrees, then you should come straight to the accident and emergency department. Do not delay.
Okay, but what helpline do you mean?
Oh, when you first start treatment, we'll give you an alert card which has the 24-hour urgent advice helpline phone number on it. There's somebody available to help 24 hours per day, 7 days per week. But if the line is busy, please do keep trying. The nurse who answers the phone will tell you whether you need to attend the hospital, either to clinic or to go to A&E, and give other advice. This helpline number isn't for general questions though, it's just for if you feel really unwell. But if you develop severe chest pain or difficulty breathing or severe bleeding, then you should dial 999.
I understand. That sounds scary actually, having to call 999.
Oh, I'm sorry, Yugochi. I know this is an awful lot. I have to prepare you though for what could happen, but that doesn't mean it will happen. Look, a lot of what I'm saying is not common, but you do need to know about it.
Okay, yes, I see.
Is it okay if I tell you about some of the other side effects that can happen with chemotherapy?
I'm listening.
A lot of people are anxious about being sick whilst receiving chemotherapy.
I was going to ask about that.
Nausea, that's feeling sick, and vomiting, that's being sick, used to be a big problem with chemotherapy, but it's really not such a problem anymore. And that comes down to how well the anti-sickness drugs that we have now work, and how we use them. You see, we start these anti-sickness drugs before you have any chemotherapy. We also give you more to take home for several days afterwards. Some tips to help manage nausea include eat little and often. Let other people prepare food for you if possible. Oh, and do ensure that you drink plenty. It's really, really important that you don't become dehydrated. If you go home after treatment and start being sick, there's always a backup plan to use alternative anti-sickness drugs. So if you are vomiting, you should call that helpline that we discussed just now.
That's reassuring. I really can't bear being sick.
Of course. Chemotherapy can also affect your tummy, your bowels. Constipation and diarrhea, unfortunately, are common side effects of treatment. But diarrhea is more worrying for us as the team looking after you because of the risk of dehydration. If you start to pass frequent loose watery poo, we do need to know about it, and again, you must phone that 24-hour urgent advice helpline.
Got it. If I need to run for the loo, I need to remember to tell you.
Another side effect to watch out for is tingling or numbness in your fingers and toes. This is because some chemotherapy drugs can affect the way your nerves work. If this becomes uncomfortable or constant, we may just need to reduce the dose of the drug that causes it. The doctor or nurse will ask you at your appointment about changes in sensation in your fingers and toes.
Uh-huh. Okay. I'll make sure to put it in my treatment diary if it happens.
Over time, repeated doses of chemotherapy can affect other things in your blood, such as the way your blood clots. That's something we monitor through the blood tests you have before each dose of chemotherapy. We want to check that the part of the blood which makes sure it clots, the platelets, are within a certain range. We also want to make sure you're not anemic. Anemia really just means that a part of your blood called red blood cells are low, and this can make you feel very tired and sometimes short of breath.
Hang on. Why can't you just say that the doctors and nurses will be checking other things in my blood and leave it at that? I can't keep an eye on my platelets by myself at home every night, can I?
You're right, Yugochi. You don't need to know every little detail of what goes on behind the scenes. Some people do like to know all the details, though. Everyone's different.
Yeah.
We do also like to check your blood glucose, that's blood sugar levels, because some of the drugs we give you can cause these to change. And likewise, if you're already known to be diabetic, some of the drugs can cause your blood sugar levels to become unstable.
Yes. Okay. You know, my hair falling out is one of the first things I thought about when the doctor told me I would need chemotherapy. Could we talk about that now?
Yes, let's do that.
You see, I had this image of what cancer looks like in my mind, and that person I picture is always bald. Will my hair fall out?
The first thing a lot of people worry about naturally is losing their hair, but it doesn't always happen. There are only a few specific chemotherapy drugs that cause complete hair loss. Others can cause your hair to thin or become dry or brittle. If your hair is likely to fall out, your doctor will warn you beforehand. But if you're particularly worried about this, be sure to ask one of the clinical team.
Okay.
We do offer scalp cooling to some patients who are most likely to have hair loss to help preserve it. If you are offered scalp cooling, the nurses in the unit will talk you through what it involves, and then you can decide whether to try it or not. Also, you're entitled to a wig on the NHS, like on prescription, if you want one, that is. Some people prefer hats or scarves, and others stay as they are.
Yeah.
Rest assured, Yugochi, whatever happens to your hair during chemotherapy, there's plenty of advice and support to help you cope with any changes. And don't worry, it will grow back when treatment stops.
Okay, that's definitely good to know.
It's important to know that your skin will be more sensitive to sunlight whilst you're on treatment. So it really is important that you wear sunscreen in the sunshine and do wear a hat. You may also notice that your skin becomes drier or discoloured. Some drugs do cause rashes or other skin and nail changes, but your doctor or nurse will tell you what's most likely to happen to you. For skincare, we recommend a mild moisturiser to keep your skin hydrated, but above all, sunscreen.
Okay, wear sunscreen. Got it. Is it true that everything tastes of metal and cardboard when you have chemo?
Okay, let me tell you about that next.
It's just, I love my food and really enjoy my cooking. The kitchen is my happy place, and it relaxes me to cook for my friends and family.
I understand. You might find that your favourite foods don't taste the same anymore, and so you go off them or even lose your appetite. This is because chemotherapy temporarily damages your taste buds. We can't unfortunately do much about the taste changes, but you could try experimenting with different flavours, herbs and spices to see if that helps. Your taste buds will return to normal when your treatment ends. The inside of your mouth may feel sensitive or sore or dry. You may get a few mouth ulcers. Now, if this does happen, you can use salt water to rinse your mouth a few times a day, and we can give you mouthwashes and other things to use. And it's a really good idea to use a soft toothbrush during treatment. It's a good idea to get any routine dental work completed before you start chemotherapy, if you can get an appointment with your dentist in time. But if you do need to see a dentist, then you must let them know that you're having chemotherapy.
Do you recommend any special sort of diet?
No, we don't. A healthy, varied diet is good, but eating what you fancy and grazing is good too. It's important to eat regularly to keep your energy levels up. If you find it difficult to maintain your weight, your doctor or nurse may refer you to a dietitian for some advice.
What about herbal medicine? I take some capsules to help with my well-being. Are those okay?
It's really important that you tell your doctor or nurse about all medication you're taking before you start treatment, and that includes any herbal remedies or supplements, as not all medications are compatible.
And alcohol? Is it safe for me to have a glass of wine?
Yes, it is. A glass of wine isn't a problem. It's probably best avoided though on the days that you're actually having treatment.
Okay, that's good to know. A glass, but not too much more wine then.
Feeling tired or fatigue is a very common side effect of chemotherapy and can often increase over time.
Increase? Oh, that's a shame. I'm already tired when I get home from work.
Right. It can help to keep a record of how you feel on different days because you might notice a pattern and then you can plan around it. There's a lot of help and advice on coping with tiredness. Just ask us, won't you, if it becomes an issue for you? And do accept help from family and friends who are looking out for you.
And what about work? What do other people usually do?
Well, it's a personal decision whether you choose to continue working during treatment. You can talk this through with your doctor or nurse and also ask your boss about flexible working. Not just days off for the actual chemo, but maybe going part-time or doing fewer shifts. That's pretty much all I wanted to say on side effects just for now. Unless you had a question, Yugochi.
Do I just turn up to the unit on the designated day?
Yes, you'll be given a time to attend. Okay, let's talk about your actual chemotherapy appointment now. So, first, you'll be taken to a chair and made comfortable. Now, it can be a long, tiring day having treatment, and time can pass quite slowly. So we want you to bring along your books or magazines, or your tablet or Kindle, and even crafts like crochet or knitting if you like. Basically anything that helps to keep you occupied, relaxed and comfy. A cosy blanket or shawl can be nice. You can listen to music or podcasts with headphones, and even watch TV programs on download if you like. We have free Wi-Fi. And we have volunteer massage therapists who attend the unit and offer hand and foot massages some days. There's tea, coffee and snacks, and we'll give you lunch, but you can bring your own food and drink if you prefer. You might spend longer in the unit on the first day, as the nurses will explain a few things to you, and some drugs are given over a longer time period for the first treatment.
Okay, it sounds like even if it's a long day, I won't get bored. I must remember to bring my headphones with me. Will I be okay to drive myself to chemo? Or get the bus? I like the bus, but in bad weather, the car is easier and quicker.
Okay, on the very first day, we do advise you not to drive yourself up to the unit, just in case any of the drugs we give you make you feel sleepy. You can then make an informed decision on transport for any later appointments. Do you have any other questions, Yugochi?
I don't think so. You've told me a lot today. Oh, actually, yes, I do. Can I bring my partner with me when I have chemotherapy?
Yeah, it's fine for somebody to come with you, Yugochi, but they won't, however, be able to sit in the room where you have treatment because there's limited space. Your partner can wait in the reception area or head out and then come back at the end of treatment when you're ready to go home. Anything else you'd like to ask?
It's a bit personal, but can I ask about sex and intimacy? Is it okay to still have sex whilst on chemo?
Of course you can ask about sex. You can ask anything. It's fine to have intercourse, but you will need to use barrier contraception, like a condom. It's important not to get pregnant whilst you're on treatment. A condom will also protect your partner from being exposed to any of the chemotherapy drugs, while they could still be active in certain body fluids.
Okay. And is it okay to take a short break away? I love the sun. We already have a holiday planned, but can we still go?
Usually, yes, but just run this by your doctor or nurse. Anything else you'd like to ask?
Not at the moment, but I expect I'll think of things later. Thank you, Joe.
Oh, don't be afraid to ask your doctor or nurse any questions. No question is too small. We also have Macmillan Information and Support Centres at some of our hospitals, and the staff there are really good with hints and tips on coping with chemotherapy side effects at home. They've even made videos on nausea, taste changes, sleeping better, and nail changes that you can watch on the Royal Free website. The link to the webpage is in the description of this video below.
I will definitely pay them a visit, and if I get these side effects, I'll remember the videos.
There are other places you can go for cancer support too. We've got a brand new Maggie Centre at the Royal Free Hospital, which is definitely worth a visit. And then there's Cherry Lodge in Barnet, and the Nightingale in Enfield too. I hope you got you starting to feel more confident. It's natural, of course, to be nervous before the first treatment, but nobody goes through this alone. There's a whole team of us right here to look after her during her chemotherapy treatment.
Well, I understand a lot more about chemotherapy now, but I won't lie, it's still very daunting. Joe has talked about a lot of side effects today. I really hope I don't get many of them, or any of them, if that's not too much to ask. I suppose once I actually start treatment, it will make much more sense. For now, I'm off to grab my notebook and pen so I can write down some questions to ask next time. Perhaps you'd like to fetch your notebook and do the same. Or maybe it's just been a lot to take in and you'd like to go through all of this again. Feel free to rewind, rewatch, and repeat as many times as you like. You can also share the link with family and friends. Good luck.